Mystery, but a welcome one. For some unknown reason, asthma rates among children and young adults are falling, according to a new report. But the numbers here are still high by world standards, and the poor and disadvantaged are more likely to suffer. Medical reporter Sophie Scott has the story.
26-year-old Mary Mussolino was diagnosed with asthma last year. It comes on when she gets hay fever or exercises.
When I was involved in any sort of heavy exercise or cardio, I noticed a tightness in the chest. I'd get coughing fits and I just found difficulty breathing.
She's one of 2 million Australians who suffer from the debilitating condition. But in some good news, the latest statistics show asthma is on the decline.
Since 2001, the number of children and young adults with asthma has fallen by approximately a quarter.
It's really pleasing to see that the prevalence of asthma amongst 5 to 34-year-olds has declined, and by such a significant amount.
But researchers admit they're not sure why the rates have gone down.
This sort of fairly rapid changes in prevalence of the disease strongly suggest that environmental and lifestyle type of factors are responsible, not genetic factors.
Despite the improvements, the incidence of asthma in Australia is still high by world standards.
The Asthma Foundation is concerned that people keep the good news in context. So 1 in 10 Australians still have asthma. There's been no decline in the prevalence for people 35 years plus.
And there were higher rates in poorer and Indigenous communities. Doctors say the costs of asthma medication might be to blame.
Again, we can't be certain about what the explanation for that is. Certainly we don't know why they have a higher risk of having asthma.
Experts say the majority of people with asthma don't have a written asthma action plan, despite national guidelines over the last 20 years recommending their use. Sophie Scott, ABC News.